Hi, I'm Dr. Nalini Prasad here at Sacramento Hair Doctor. I have been performing hair transplants for approximately 8 years. I am a member of the ISHRS, which is the International Society for Hair Restoration Surgeons. I am committed to doing my absolute best for each patient that comes in here that is wanting to know about their hair loss needs. Today I'm going to be talking to you about hair transplant. So hair restoration is used for those patients that are losing hair in a certain area of their scalp. So men with the male pattern hair loss, and for women when they're losing hair towards the front. So not the generalized overall hair loss for women, but when it's a specific area of hair loss. And hair transplant is basically taking hair from the nice area, the permanent hair zone in the back, and actually transplanting it to the area of need, whether it's the crown or the frontal area. So in our clinic, what I have found in the last 7 to 8 years is that most patients walk in and they're not looking for the strip procedures, which is the FUT procedure. That is and was more common in the past when a strip of scalp was taken out from the back, and once the hair was individualized from there, it was placed in the front. But most people nowadays do not want the linear scar that can leave. And so more and more in our clinic, we are practicing the FUE procedure. The FUE is where individualized hair grafts are removed from the back of the head using a coring device, and then after they're examined in the microscope, then they are placed into the area of need. So in our clinic, we're finding that more and more patients are requesting the FUE, and that's what we tend to concentrate on at this point. So basically what I do when a patient comes in and asks me about the fact that they're having hair loss is to really evaluate what is going on for them. So this means looking at what might be other diseases that they are having, what is the type of hair loss that's happening, is it in a particular part of the scalp or is it generalized, so on. So basically looking at what type of hair loss are they having. Sometimes the way to treat it is going to be through medical management, which is taking care of an anemia that may be present, taking care of thyroid issues that may be present. It may be that they're too early to do anything right now, but taking something like Propecia and using minoxidil. So those are the types of things that I will determine. Sometimes it's figuring out exactly what's going on, and that might require a scalp biopsy and looking at what's happening underneath the tissue. Secondly, we do have the laser cap that we offer here for those patients that might want to use laser treatments to help the hair growth that's happen. This is a cap that they would be using at home, however, on an individual basis. We do offer PRP for many of our patients that are not yet ready to do any type of a transplant procedure, but want to be non-invasive. So PRP is where we draw blood from the patient, spin it down, get the platelet-rich plasma, and re-inject that into the scalp. I find that to be a great treatment to be used sometimes for those patients that are not transplant candidates, or as an adjunct to a transplant procedure. If we decide that a patient is ready and wanting to do a hair transplant, then we can look at what type of hair transplant they would like. Most of the patients that are coming in these days are requesting the FUE procedure if they're wanting to do a transplant. Well, anything where you're removing a piece of skin from one place and replacing it in another place will cause some pain, but just like when you're going to the dentist and they numb you with local anesthesia, we will also numb you with that same type of Novocaine in the area that we're working on, so it should decrease, it should basically take away the pain. After the treatment, most patients find that there's a soreness that they will feel, not so much pain. Occasionally, because pain can be individual for patients, occasionally they will find that they might need a couple of doses of Norco or Vicodin, but it's very rare that that happens. Once we've done a hair transplant, it takes about a full year to see your final results. The hair is going through several different phases. It can either be in an anagen phase, catagen phase, or a telogen phase. Well, once a transplant is done, sometimes the hair will go into a little bit of a resting phase, and then it takes it a little while for it to start growing again. For this reason, we really make our final judgment for the patient a year after the transplant procedure is done. The length of time that it takes for a transplant procedure is anywhere from 4 hours to 8 hours, and it's determined by the number of grafts that we are actually transplanting. Is the procedure all done the same day? Yes, the procedure is all done at one time, the same day in our clinic, in our operating room. And the reason for that is because the grafts need to stay out and be out of the body for as short of a period as possible. So it is very important that the harvesting and the transplant part of it is all at the same time. Typically, for the donor area, the harvested area, for women, we camouflage it very well by having their long hair cover up the area that we've harvested from. And for men, it takes about a week or so for enough of the hair that's remaining to grow out to cover the little tiny spaces that are created where the hair is taken out. The healing time back there is usually about 3 to 4 days. In the recipient area, there are scabs that are left behind that can be present for about 10 to 12 days. So there's a little bit of a scabbiness, but typically most people will cover that up very well with their hair that is present at the time of the procedure. You can use a hat or a cap about 72 hours after the procedure also to cover up that area. So typically after a transplant, we recommend that patients take about 3 to 4 days to perhaps work from home, at which time they recover from the transplant itself. Sometimes there's a little bit of swelling of the face that makes it uncomfortable for people to be out and about, more aesthetically rather than functionally. So recommendations about 3 to 4 days of taking off from work. So the best way to evaluate what is happening for you is to make an appointment in our clinic. You can call 916-783-0580 and come in for an evaluation. That would be the first step.